Welcome to session 1 of Pranayama 1. In this session, we are doing things a little bit differently from the rest of the sessions of Pranayama 1. One is that it is broken down into several small snippets so that you can listen to these things at your leisure. You do not have to tire yourself, fatigue yourself mentally by listening to it all at once. Secondly, you do not really have to do anything else apart from just listening, but it is of a practical nature. This is not theory, this is not a lecture. So, please do listen to all the parts of the first session snippets. Okay, and let us look at just some logistical details. Clothing. Please be dressed maybe a little more comfortably than you are in an asana class, but be prepared to do some asanas. Pranayama 1 specifically is sort of like a threshold between asana and pranayama. So, we will sometimes go towards asana as well. So, be clothed in such a manner that you can do asanas including inversions. However, when we are attempting our pranayama practice, it is very possible that the body temperature goes lower, that you feel a little cooler. So, please have some layers with you like a jacket or a sweater or even full pants. For women during menstruation, the same guidelines apply that apply during asana classes. So, do not do anything which involves very strong abdominal work, abdominal contractions, and if we are attempting any asanas, then please do not do anything which involves going upside down. It is very unlikely we will be doing strong back arches or twists, but yes, do not go upside down. For any other mental conditions like anxiety, depression, if you are going through an episode, pranayama is actually not recommended. However, the base positions of pranayama, of many of the base positions of pranayama are also suitable for doing things which will address your condition. So, supported back arches, for example, Viparita Dandasana supported, Supta Baddha Konasana supported, they are all very good if you are feeling mentally low. Do not do the act of pranayama, the kriya of pranayama, but take the base position, treat it as an asana and you will most likely feel better. In general, if during pranayama you find yourself in a position where you are feeling really uncomfortable, like your mind is in a turmoil and something is hurting, paining and you can't really focus on what is going on or what you are being asked to do, please release the position, take additional props and see if you can find a little more comfort, change the position, take another complementary position and then continue with the work. You do not have to seek permission from the instructor all the time. If you are sure what might be a better position for you, please feel free to go ahead with it, make the change. Pranayama 1 commences with Shavasana, Shavasana done with the least amount of props. Well, it is actually something between a Shavasana and a Supta Tadasana. There are some cases where this kind of a position unsupported might not be suitable. For example, if you have back pain, severe back pain, if you have sciatica, then at the very least take your legs a little wider. You can also bend your legs or you can even lift your legs up if that brings relief. If there is any condition where it helps to have the chest elevated, like if you are feeling mentally very low going through depression, also if you have cough and cold, if there is a lot of phlegm that is coming out, please prop yourself up. At the very least take a head support, but preferably take a bolster or a stack of blankets to lift the entire back body up. Just a recommendation, if the floor is cold and we are going to do this module going towards the colder part of the year here. So, I would recommend layer up your mat. You can either open up a blanket and put it on top of the mat if it is a thin mat, or you can take a second mat on top of the mat so that you have a little more cushioning, a little softer surface and also some distance from the floor so that you do not get cold. If you have already caught a cold and if there is no phlegm etc., then please carry a tissue paper with you and use it as required. In addition to that, please carry with you a small like a napkin. This is approximately half the size of a hand towel. These are kitchen towels. So, something like that. We are going to use it in various ways. When we commence digital pranayama is the use of the digits, the fingers in doing pranayama, most commonly used to block the nostrils. So, whenever we get there, long nails will not be complementary. So, if you want to do digital pranayamas, you will have to clip your nails. I think that is it. If you are interested in the theory and the theory is important, it really does complement the practice, then join our reading groups or join a sutra study group, and we will continue the discussion there. Let us start.